Hello, I'm Dr. Ken Harper, the founder of Vein Specialists at South, where we're excited about improving the quality of patients' lives while helping them enjoy healthy veins for life. Your providers at Vein Specialists at South are leaders in vein care. That's evidenced by the fact that they're regularly invited to speak at the national conventions concerning vein care. Not only our clinical providers, but our front office staff come and share their expertise. This is important to us, it's important to me, but also I think it would be important to you to know that the people providing your care are respected leaders in their field. On behalf of the Vein Specialists of the South team, I want to welcome you here today to this vein education and evaluation session. We're excited to be part of you beginning your journey to healthy veins for life and want to thank you for choosing us as your vein specialist. You may wonder why educating patients and physicians about vein disease is so important to us. That's easy. It's because vein disease is common, underdiagnosed, and undertreated. If you look at all the patients with vein disease, that's people with varicose veins, spider veins, and leg swelling, you would find that there are more people with vein disease than those with heart disease and arterial disease combined. That's a big number. In the United States, that's well over 25 million people. The presenting findings of vein disease are often confused with other disease processes, and they also may be sometimes considered by patients just to be a normal process of aging. And that's because the findings can run from vague to a few spider veins with no symptoms, to crampy, achy legs that hurt at night, burny, stingy, those kind of things. And they can have those sometimes with no visible veins. So you can understand why they might go to their primary care doctor and complain and be told, oh, there's nothing, there's no problem, we don't find anything wrong with you. Other patients, it's a little more obvious, they have bulgy veins or spider veins, but they're oftentimes also told, don't worry about it, it's a cosmetic concern. Well, I'm here to tell you that it can be more than a cosmetic concern, and left to itself, it will only get worse and lead to problems that could easily be avoided if you sought care sooner. Unfortunately, vein disease is chronic and progressive. That means if you do nothing, it's only going to get worse. So that's where we come in, and we like to work with our patients to create a partnership where there are things that we can do that turn back the hands of time. Maybe get your legs looking like and feeling like they were 10 or 15 years ago. There are things that you can do that slow down the hands of the clock. And that's why making a plan that you understand what you can do. And those, I call them the 5 healthy leg principles for women. There are 4 for men, you'll understand why in a minute. But the 5 healthy leg principles are regular exercise. We're not talking about marathons. If you can walk for 30 minutes a day, 4 or 5 days a week, that's great. Healthy weight management, wearing medical grade graduated compression on a regular basis, and taking a break in the morning, afternoon, evening to prop your legs up. Now the 5th thing for women is high heels. It's okay to wear high heels on special occasions, but they shouldn't be a regular part of your wardrobe. Patients often ask me, why did I get varicose veins? And that's a great question. You know, the number one reason is genetics. You inherited it. Now, we occasionally see patients who have no family history of vein disease. So it's not always inherited, but the number one reason for vein disease is inherited. Now, if you have a family history, you could maybe help prevent that by doing those conservative measures we mentioned, like regular exercise, healthy weight management, wearing compression hose, elevating your legs, those kind of things, so remember that. The second risk for vein disease is gender. Vein disease is much more common in women. You know why? Well, it's hormonal. It's related to hormonal shifts during their lifetime, but also with pregnancy. If you've had a child, you know there are a lot of changes that happen during pregnancy. Some of them actually begin the day of conception. Those hormonal changes begin. Then they're followed by increase in blood volume to supply blood for the baby and the placenta. And then as the baby grows, it exerts pressure on the veins that drain your legs so that they tend to swell and the veins become more engorged with blood. These are all factors that result in pregnancy being the second cause of varicosities. The third risk factor is occupational. Any career that requires you to stand or sit a lot puts you at risk. So that includes people like teachers, factory workers, pharmacists, nurses, physicians, you name it, a lot of us are at risk. And if you know you're at risk, remember prevention is very important. Another interesting subset of patients that are at risk include aerobics instructors and bodybuilders. they put a lot of stress and strain on their body, and including those people who like to run marathons. So it's important to do whatever you can. I say, if you're going to exercise, go for it. But try to do the things you can to help prevent the problem, and come to see us at the first sign of an issue. The venous system is part of the vascular system. And the vascular system includes the heart, which pumps the blood out, includes the arteries, which take the blood to the peripheral tissue, taking the oxygen and nutrients, the capillaries, where on the cellular level, there's a transfer of oxygen and nutrients, and then through the veins to return back to the heart, and the vital organs where the process starts all over again. If we want to individualize it to the venous system, I like to talk about the veins being three parts: pumps, pipes, and valves. It sounds kind of like plumbing, doesn't it? When we walk, our body was created in such a way that the walking mechanism of the foot pressing on the floor and the calf muscle contracting acts as the heart for the venous system. It forcibly pushes the blood back up the veins, even against gravity. Now, if that's all we had, it would be okay, but not excellent. So we also have valves. The valves are little check valves in the vein itself that allow the blood to go up and then close to prevent it from falling back down. So you see, when your muscle contracts, it pushes the blood up, but when your muscle relaxes, the blood would fall back down if those check valves weren't working properly. And then the other thing, of course, the pipes. The pipes are the vein themselves. Patients often ask, well, how can you treat a superficial vein, or what happens to the vein to the blood if you treat it? I look at it like this. If the healthy veins are pumping the blood out of your leg and the unhealthy ones are allowing some of that to fall back down, if we could simply eliminate the unhealthy vein, then what do you think? Would the healthy vein be more efficient or less? It's kind of a tricky question, but if you think about it, you'll understand that the healthy vein actually has less work to do. So when we're evaluating a patient for their vein disease, that's what we're trying to determine. What's the bad vein? What's the good one? Our goal is to work on the bad ones and leave the good ones. And that way we can actually improve the circulation. It's kind of sometimes counterintuitive, pretty simple. Leg swelling is part of phlebology, the treatment of venous disease, but that also includes lymphatic disease. The lymphatic system carries the lymph or lymphatic fluid from the periphery back toward the heart also, just like the blood, but it goes in its own system, the lymphatic system. It involves ducts, small pumps called lymphangions, and the lymph nodes. We found that if your body is overwhelmed by lymphatic fluid, that it doesn't function as well. And it can lead to problems like infection, severe swelling, skin changes. Those patients' lives can be dramatically affected in a negative way. We're fortunate enough to have an occupational therapist who has over 20 years experience in treating people with lymphatic disease. We found her expertise to be invaluable to our patients with both venous and lymphatic disease. The most common underlying problem in venous disease is a defect in the one-way check valves. When the check valves are damaged, they allow blood to pool or settle in the leg. It's almost like a waterfall effect. If you've ever been to waterfalls in North Georgia, you've seen the beauty, but you've also seen the tremendous power, the damage they can do over time. And that's what happens with reflux in the veins in the leg. Over time, they cause the superficial veins to become broken and varicose and tortuous. You've probably seen people that suffer with this kind of problem. That's why it's so important to correct the venous reflux, to correct the damage done by the one-way check valves. Because the sooner you can deal with it, the less damaged veins there'll be. So if you see a problem, come see us. Let us help you determine what the problem is and deal with it sooner rather than later. Thanks.